那你这边开始了吗？现在开始了。哦，好的。因为我把它按掉了。
静音哈，谢的真要静音了，3、2。
他不说一。Hello, this is the second affiliate hospital, Zhejiang University School of Medicine. Welcome to our live stream channel on WeChat. So today we're going to tell you something about gum disease. This lecture will be delivered by Dr. Ge from the general dentistry of our hospital. And if you have any question during the lecture, please feel free to type in the chat box in the bottom. So now let's hand it over to Dr. Ge, please.
Thank you so much for the brilliant introduction. So hi guys, I'm Dr. Ge from the Department of General Dentistry. Thank you so much for having me tonight, and I'm very happy to be here today to share some knowledge that I think is worth knowing about gum disease. If you have any questions, feel free to text in the comment box below, and we're gonna be answering those questions by the end of the lecture today. So hope we're gonna have fun tonight. Before let's begin with the topic today, please allow me to introduce myself a little bit. So my name is Ge Ziyu. I know that's a little bit difficult to pronounce, so you may also call me Jessie, which is my English name. So I graduated from the University of the Philippines in 2017. After my graduation, I started working as a general dentist at the Department of General Dentistry at the second affiliated hospital. At the same time, I'm also a class advisor for MBBS students in Zhejiang University. Well, in order to provide better services for my patients and further broaden my knowledge, I'm now pursuing a MSc degree at UCL Eastman Dental Institute. Aside from being a dentist, I also play piano. We actually have a band in the hospital, and I'm the keyboard. Very proud of that. Aside from that, I also play golf. I would spend time with my family playing golf during the weekend. And I love eating food. I'm a crazy foodie. And aside from that, during this summer, I got obsessed with skateboarding. I hope I won't get any fracture by the end of the summer. Oh, and I cannot wait the pandemic to be over so that I can travel with my friends again. All right, so enough about me. Let's now go back to dentistry. Let me first ask you a few questions. Have you ever experienced any swollen gum? Or have you ever experienced bleeding when you are eating food or when you are brushing your teeth? Have you ever tried to check your teeth inside the mirror and find out that your gum is receding? Or have you ever heard your grandparents saying that my tooth is so mobile, why is that? Well, that is all because of periodontal disease or gum disease. So first, what is periodontal disease? Well, when we look at a cross-section of a tooth, we can find out that beneath the tooth structure here, we have gum surrounding it. And beneath gum, we have bone. So again, beneath there are gums surrounding the tooth structure, and beneath gum, we have alveolar bone. So the bone and the gum together, we call that periodontal tissue. And periodontal disease refers to an inflammatory disease that affects the hard and soft tissue that support the tooth. So in the other word, periodontal disease is a disease of the gum and bone beneath the tooth. So some of my patients ask me, if I don't have cavities, does it mean that I do not have gum disease as well? Well, that is unfortunately not true, because as you can see, tooth and periodontal tissue are two completely different structures. So sometimes, even if you have perfectly healthy tooth with no cavities at all, you might still have gum disease. At the same time, sometimes a patient has very bad or severe gum disease, but then the tooth still seems perfectly fine. So no, even if you don't have cavities, it does not mean that you do not have gum disease. Well, that is actually one of the many misconceptions that my patients have. Now I'm going to show you many of other misconceptions that you might have, and let's see if we can break them one by one and know the actual facts. So myth number 1, cavities are the #1 cause of tooth loss. No, that's not true. Gum disease is actually the #1 cause of tooth loss. Some fun facts about dentistry. Okay, myth number 2, periodontal disease is only limited to elderly. That is not true as well. Well, according to a CDC report that studied the prevalent rate of periodontal disease in the States, they show that for adults who are aged 30 years old and older, 47.2% of them have some form of periodontal disease, which means that in every 10 patients or in every 10 friends that you see, 5 of them have periodontal disease. And the prevalent rate is even higher for those patients with age 65 years old and above. And the prevalent rate is 70.1%, which means that for every 10 grandparents or elderly that you see, 7 of them have periodontal disease. So it is actually a very prevalent disease, and it's not only limited to elderly. You can have it, I can have it, we're all in this together. Myth number 3, well, the gum is inside my mouth, so I would always know if I have gum disease. That is not true as well. Most of the people, they do not know they have gum disease because gum disease at the early stage are usually painless and cause no obvious symptoms. So we also say that gum disease is a silent killer. So no, you do not know if you have gum disease. Please check with your dentist regularly. Myth number 4, gum disease does not affect my overall health. That is a no-no as well. A lot of research has already found out that gum disease is closely related to other systemic disease, such as diabetes, low birth weight, stroke. So the gum disease is not only limited to our mouth, it is also about our overall health. And myth number 5, because gum disease is a bacterial infection, antibiotics can be used to treat it. No, that is not true. Well, that is partially true because gum disease is a bacterial infection. But by using antibiotics alone, it could only be used as a helpful adjunct to help us control gum disease, but it is not the cure. Again, antibiotics is only an adjunct, it is not the cure. So, and mechanical removal of the plaque is the only cure to periodontal disease. So please, if you have swollen gum, do not just eat antibiotics by yourself. That is not right. So now I hope you had a general idea of what periodontal disease, and I hope that you are now taking this disease more seriously. And some of you might even feel anxious, like, do I have periodontal disease myself? So how do I know if I have periodontal disease? Here I listed some of the common symptoms of periodontal disease. You may see it as a checklist and see if you have periodontal disease or not. So some of the common symptoms include swollen gums, bright red or purplish gum, because the healthy gum actually looks like coral pink, and the unhealthy gum looks a lot more redder. Aside from that, your gum might feel tender when you touch it, and gum is very easy to bleed, especially when you're brushing your teeth or eat something that is hard, such as apple or cucumbers. It might bleed. Aside from that, you might also experience bad breath. But then bad breath could also be a problem of intestinal disease. So you also need to consult your doctor. And bad breath is not equal to gum disease. Aside from that, if you see pus between your teeth or gum, that is also a symptom of gum disease. And if you are experiencing any loose teeth or loss of teeth, that might be periodontal disease. And if you check yourself in the mirror and you found out that your teeth is looking longer now, you have gum recession, that is also a common symptom of periodontal disease. And if you feel a change when you are biting food, or you are experiencing any discomfort when you are eating food, that might also be a common symptom. So if you have one of the symptoms that I mentioned above, you might have periodontal disease. But again, as I mentioned before, periodontal disease is a silent killer. So even if you don't have those symptoms, I still suggest you to go to a dental clinic or go to your dentist and see if you have this disease. Okay, so now some of you might be wondering, why would I have periodontal disease? Where does the infection come from? I eat super healthy, I sleep well, why do I have the disease? So now I'm going to tell you what caused periodontal disease. Well, actually, the pathogenesis of periodontal disease is very complicated. So I downloaded a very brilliant video from YouTube to give you an overview of the pathogenesis of this disease.
Of soft tissue around the necks of the teeth, where they emerge through the gums. Healthy gingiva are pink in color, and the sulcus depth ranges from 0 to 3 millimeters, measured from the tip of the gingival margin to the base of the sulcus. The attachment fibers connecting the gums to the teeth and the teeth to the bone are intact. The gums are resilient and neither bleed nor hurt when being probed. During meals, food debris accumulates in the sulcus. When mixed with mouth bacteria and proteins from saliva, plaque and less obvious biofilm are formed. Both are harmful to teeth and periodontal structures. Left in place on the teeth, bacterial plaque and biofilm begin to mineralize, forming hardened deposits called calculus, which can only be removed with dental instruments. In response to the increased bacteria adjacent to the soft gingiva, the body sends immune cells and healing cells to the area by way of the circulation. The increased blood flow to the gingiva produces red, enlarged, and tender gum tissues, a reversible condition known as gingivitis, in which the periodontal attachment fibers remain intact. Continuous exposure to acids and enzymes from plaque bacteria and the body's immune response to them eventually causes the periodontal attachment to be lost, an irreversible condition known as periodontitis. The sulcus depth increases to the point where the patient can no longer effectively remove plaque, leading to the destruction of tooth-supporting bone. Smoking impairs blood flow and can significantly interfere with the patient's ability to fight the bacterial infection. Other factors may be involved. Generalized periodontitis affects all of the teeth. They may loosen, appear unnaturally long and unattractive, and may ultimately be lost. When multiple back teeth are lost, the front teeth may be unable to support closing forces of the jaw muscles. They begin to tip and move. The cheeks begin to collapse inward where the back teeth are missing, and the lack of proper support for the jaw joints may cause them to ache, pop, and click. Periodontal bacteria can enter the body's circulatory system through leaky blood vessels. Once inside, the bacteria can lead to blood clots and inflamed vessels, which constrict in diameter, leading to strokes, heart disease, heart attacks, and poor circulation in the extremities. Of soft tissue. Of soft tissue.
Does the video seems kind of confusing? Well, it's okay, don't worry, because the pathogenesis of periodontal disease is very confusing. So I'll explain the pathogenesis again. So to keep the story short, the story always begins after we eat or drink food. The food debris will adhere on the tooth structure just as it's shown on the picture here. And if we do not remove those food debris, the bacteria will adhere on it. And this together will form what we call plaque. So this would be a plaque. Well, the plaque, if we do not remove the plaque will harden and become calculus deposit, and it will physically cause inflammation of the gingiva. At the same time, as I just told you a while ago, there are many bacteria inside plaque, and those bacteria will try to send out some toxin particles and try to hurt the gum. So at this stage, we will see that the gingiva is inflamed. But at this stage, it's still reversible because only the gum is inflamed. The bone is still perfectly fine. So at this stage, if we try to remove the plaque by toothbrushing, or if we go to a dentist to remove those plaque, the gingiva can still go back to its healthy state, and the whole thing is totally reversible. But at this stage, if you do not remove those plaque, the plaque will continue to accumulate, and the bacteria will continue to send out toxin, which would harm the gum tissue. Now the body might sense those bacteria toxins, and they will try to fight off those bacteria. by sending some macrophages or lymphocytes. While fighting off those bacteria, the body will also hurt some of the gum tissue. So because of the effect of bacteria toxin and immune response, there are now tissue destruction, which is bone destruction. As you can see, the bone level here will become low. And because the level of the gingiva go with the bone, that's why now you have gum recession. At this point, if you go to a dentist and remove those plaques, then the bone level will stay here and no longer recede. But if you still do not go to a dentist, the bacteria and the plaque will continue to accumulate and thicken and thicken. So more bacteria will be adhere on the plaque and more toxin will be released by the bacteria. And the body will send even stronger immune response to try to fight off this inflammation, which will result in more severe bone destruction. Well, a tooth without bone is like fish without water, it's like flower without soil, it's like our building without foundation. So if the bone level continue to decrease, the tooth will become mobile or become wobbling or become loose, and eventually it will fall off. So again, what causes periodontal disease? It's actually the plaque. Because if we do not have plaque, then we do not have bacteria adhere on it. If we do not have bacteria, then we do not have this whole inflammatory disease, and we would not have those inflammatory process. So again, what causes periodontal disease is actually the plaque. So now you might asking, are there more people that are prone to periodontal disease than others? Because actually, both of my grandparents, they have poor oral hygiene, but it seems like my grandma's teeth are perfectly fine, but then my granddad's teeth are falling off one by one. So why is that? Well, actually, there are several risk factors that will make you more prone to periodontal disease than others. Let's look at them one by one. So first is smoking. Well, do you need another reason to, advise you to stop smoking? Well, there is one. Because according to the American Dental Association, smoking is one of the most significant risk factors in the development of periodontal disease. Because the nicotine in the cigarette might slow down the healing process of the gum and decrease your ability to fight off the inflammation. Aside from that, a very scary fact is that the nicotine in the cigarette will cause vasoconstriction, meaning that people who smoke might have less severe symptoms of periodontitis. So smoking is #1 risk factor of periodontal disease. Please quit smoking. Aside from that, pregnancy is also a risk factor of periodontal disease. Well, because the gum tissue is the target organ of hormone change. So if you already have plaque inside your mouth, and if you are pregnant, the manifestation of the gum will be even more severe. That's why we suggest girls or women who are planning to get pregnant to have dental checkup first before getting pregnancy. Because another very difficult point is that during the pregnancy, in order to avoid any miscarriages, we usually do not perform dental procedures on pregnant women. So it will be the best if you have your dental checkup before pregnancy. Aside from that, diabetes is also a very big or major risk factor of periodontal disease, because people who are diabetic have slower healing rate than normal people. That's why when we see diabetic patients with gum disease, we usually ask them to go to endocrine department first to have their blood sugar controlled first before going to the periodontal procedure. So diabetes is another very major risk factor. Aside from that, certain medication might also cause your gum to swell even more. Some of the medication include anticonvulsants, calcium channel blocker, and cyclosporine. That's why sometimes in the clinic, if we see a patient with only a little plaque, but then their gum is swelling a lot, we might suspect that they're taking certain medication that will fasten the inflammation of your gum. For those patients, we will usually ask them to go to a pharmacist or go to their physician to change to to another alternative medication. Aside from that, other risk factors include osteoporosis, malnutrition, obesity, and some blood disorders. So some of you might be scared. If I have those risk factors, does it mean that I would have periodontal disease for sure? Well, that is not true, because risk factors are something that will fasten the progression of the disease. But if you do not have the cause, then the disease will not happen. So for example, if a smoker have a very good oral hygiene and with no plaque inside his mouth, then he might not have periodontal disease. On the other hand, for example, a pregnant woman, even if she is pregnant, but she does not have any plaque in her mouth, then she would not have swelling gum. So risk factors are just risk factors. Keep good oral hygiene is still #1 key to good oral health. Aside from that, even if you have those risk factors, don't worry, because doctors can collaborate across different disciplines to help you and develop a personalized treatment plan. So for example, if you are a diabetic patient and your diabetes is not controlled, it's okay, don't worry. We can collaborate with doctors in the endocrine department, and we're going to work together to sort the things out. Okay, so now we know that some of the systemic disease might affect the progression of periodontal disease. So will periodontal disease also alter the progression of systemic disease? Will gum disease also affect other systemic conditions? The answer is yes. Because the bacteria inside the pocket of the tooth could enter the bloodstream from the pocket, and then those bacterial toxins will move from the tooth to other distant organs, such as lungs, kidneys, heart. Aside from that, because the gum disease is an inflammatory disease, so the localized inflammatory changes might also trigger other systemic inflammatory changes in other parts of the body. So that's why we say that without good periodontal health, you cannot have good general health. Well, studies have already proven that periodontal disease is closely related to stroke, Alzheimer's disease, cancer, respiratory disease, heart disease, diabetes, and even rheumatoid arthritis. So please, even just for the sake of your overall health, please keep good oral health. Now you might feel a little bit information overload. So let's have a quick recap of what we just talked about. So first, what is periodontal disease? Periodontal disease is an inflammatory disease that affects the hard and soft tissue that support the teeth. What are the symptoms of periodontal disease? Well, there are many symptoms of periodontal disease, but the common symptoms include swollen gum, bleeding gum, mobile teeth, and receding gums. What causes periodontal disease? I think that is a simple question because I've already said it for a lot of time. Plaque is the cause of periodontal disease. Again, plaque is the cause of periodontal disease. So what is the connection between periodontal disease and systemic disease? Well, as I just mentioned, they can actually affect each other. Some of the systemic disease might fasten the progression of periodontal disease, such as pregnancy, diabetes. At the same time, periodontal disease could also affect systemic health. Okay, I hope you are not tired still now, because I'm going to proceed to the most important part of today's lecture, which is the prevention and treatment of periodontal disease. So how do we treat and prevent periodontal disease? Actually, it's pretty simple. As I mentioned for so many times, what is the cause of periodontal disease? It's plaque, right? Plaque is the cause of periodontal disease. So the treatment is very simple. Because plaque is the cause, then we just remove plaque, then the disease will be cured. That's why the primary goal of periodontal disease is plaque control, or minimize plaque inside our mouth. How do we do that? It is actually your job and my job as well. We need self-performed plaque control that you do daily and regular periodontal treatment or regular periodontal checkup. So let's go to the self-performed plaque control first. The first thing that I want you to do daily is brushing. According to American Dental Association recommendation, we recommend you to brush your teeth for at least 2 minutes twice daily with a soft bristle toothbrush. Because a lot of studies show that with 2 minutes toothbrushing, we can effectively remove most of the plaque inside our mouth, and we have to perform it twice a day. We need to use a soft bristle toothbrush because the hard bristle toothbrush could somehow damage your tooth structure. So again, we recommend you to brush your teeth 2 times a day with 2 minutes each time, and use a soft bristle toothbrush. So if you are having a hard bristle toothbrush, please change it to a soft bristle one. Aside from that, a lot of my patients ask me, should I choose an electronic toothbrush or a manual toothbrush? Well, the answer is that both manual and powered or electronic toothbrush could be used effectively. So it's really not the tool that matters, it's really the frequency that matters. So no matter you are using a manual toothbrush or electronic toothbrush, it will both do the job. And thirdly, please use a fluoride toothpaste. That is for cavity prevention. Well, some of my patients have receded gum and they might experience sensitivity when they're brushing their teeth. For those patients, I would recommend them to use an anti-sensitive toothbrush that you can buy in the supermarket. Aside from that, please change your toothbrush every 3 to 4 months. Or if you see that your bristles are fried, please change it. Okay, so I know that most of the people brush their teeth twice a day, but do you really know how to brush it correctly? Here, I have a recommended method of brushing. It's called modified bass technique. So the key point of this technique is that you have to put your toothbrush at 45 angle to the gum line, like this, so that some of the bristle can enter under the gum line and remove the plaque under the gum line. So please put your toothbrush or the bristle at 45 degrees to the tooth structure. And afterward, please use a vibrating back and forth rolling motion to brush the teeth so that you won't hurt the tooth structure. Again, please use a vibrating back and forth motion to brush your teeth. And after brushing the outer surface of your tooth, please do not forget to brush the inner surface as well, because actually the lingual or the inner part of the tooth is where the calculus or the plaque accumulate the most. So please remember to brush the inner surface of your tooth as well. And when you're brushing your front teeth, you can shift your toothbrush to a vertical way so that you can better brush those areas. And again, also do not forget to brush the occlusal surface or the biting surface of your tooth. And if you have free time, it would be nice to brush your tongue as well. It might still be kind of confusing after I saying this, so let's look at a short video of how to brush your teeth.
The bristles of your toothbrush should be at a 45-degree angle to the surface of your teeth. This will help the bristles reach under the gum line. Move the brush back and forth across 2 to 3 teeth at a time using short strokes. These short strokes are followed by a sweeping motion away from the gums. Continue this motion along the entire arch. Short back and forth brushing followed by a sweep away from the gums. The front teeth. Again, angle the brush 45 degrees to the tooth surface and repeat. Repeat the technique for the inside of the teeth. Brush 2 to 3 teeth at a time and progress all the way around the arch.
Okay, so I hope now you learn the correct way of brushing your teeth. Now, is brushing alone already work for everyday self-performed plaque control? Is brushing alone enough to do the plaque control in our mouth? No, it's not enough, because brushing would only help us to clean the surfaces at the outer side of the tooth, but we cannot change those plaques. We cannot remove those plaques that in between the tooth. That's why we also need interdental cleaning as well. Well, actually, there are many tools for interdental cleaning, such as dental floss, water floss, interdental flush, and end-tuft brush. Well, there are actually many different indications for those interdental tools. For example, if you have no gingival recession, and meaning that there is no space between your tooth, then we recommend you to just use a dental floss. But if you already have gingival recession, you have there's a little space in between those tooth, then we might recommend you to use a interdental brush. If the recession is even more severe and you see a bigger space, then we would recommend you to use a end-tuft brush. And there is, oh, sorry. Let's go back. Oh, no. Okay. And sorry for that. But the most recommended way of using interdental cleaning is actually dental flossing. Well, many of my patients complain that they do not know how to use a dental floss. So let's now watch a video from American Dental Association, which will teach you how to use a dental floss.
In addition to brushing twice a day, flossing once a day will help keep your mouth healthy by cleaning between your teeth where a brush can't reach. It also helps prevent gum disease. Wrap about 18 inches of floss around the middle finger with the rest wound around the opposite middle finger. Hold a small amount of floss, about 1 inch, tightly between your thumb and forefingers, and gently insert the floss between the teeth. Hug the floss tight to the side of your tooth. Rub the floss gently up and down, pressing against each tooth. And remember, get behind those back teeth. There are other products to help clean between your teeth, especially if you have braces or have a hard time holding floss. Always ask your dentist if you have any questions.
Okay, I hope now you know how to use a dental floss. Well, there are other many frequently asked questions regarding floss, and let's tackle them one by one. First, when is the best time to floss? Should I floss in the morning or should I floss in the evening? Well, actually, there is no answer to that. You can floss whenever you want, but make sure to floss at least once a day to remove those bacteria, to remove those food debris in between your teeth. Question number 2, should I brush or floss first? Well, actually, there's no answer to that too, because either way, you can do a good job, you can do a thorough job. Just make sure that you floss. Well, I personally like to floss after brushing so that I can remove more food debris. It's like after I brush my teeth, I feel like my teeth are generally clean, and so I will start flossing. But really, there is no correct answer to that. You can floss even before or after brushing. Third, can I rinse and reuse my floss? No, please do not reuse your floss, because the floss is designed to only use once. So please discard those floss after use. Okay, so after toothbrushing and flossing, some of my patients might use mouth rings. But should we use mouth rings? And some of my patients even use antibiotics regularly. Should we use antibiotics? Well, let's look at them one by one. So first, mouth rings. Should I use mouth rings every day? Or like some of my patients ask me, if I do not want to brush my teeth today, can I just use mouth rings instead? Well, let's look at some evidence. First, there are generally 2 types of mouth rings, the therapeutic and the cosmetic. Therapeutic mouth rings is those that your doctor prescribed to you. But then there are some effects of therapeutic mouth rings, and it could reduce some of the plaque, and it could make your bad breath better, but it's not good enough. That's why if you do not brush your teeth, mouth rings alone is not enough. So if you want to use your mouth rings, please make sure that you brush first and then use your mouth rings. Aside from that, many evidence suggests that there are many adverse effects of using mouth rings, such as it might remove the healthy bacteria or healthy oral microbiome inside your mouth. It might cause dry mouth. It might sting your mucosa. That's why my suggestion of using mouth rings is ask your dentist first before using it. Because for us, we only prescribe mouth rings to those patients with severe gum disease, or if they have just recent dental extraction, or if they just had their periodontal surgery. Other than that, we don't think there is a need of using mouth rings toothbrushing and interdental toothbrushing would be enough. Secondly, should we use antibiotics? Because some of my patients, after they experience swollen gum, they would just buy antibiotics, or they would just use antibiotics that they have at home. But is that correct? Well, first of all, antibiotics could be an adjunct to cure periodontal disease, meaning that antibiotics could kill some of the bacteria inside our mouth. But the thing is that it is not good enough. Well, a recent study that a recent review, they reviewed 45 articles with randomized control trial, which include 2,000 plus patients, and they found out that there are actually very low certainty evidence showing that antibiotics could help with scaling or root planing. That's why, and plus, there are many adverse effects, or there are many potential risks toward antibiotics, such as allergic reaction and antibiotic resistance. That's why what I would suggest to my patient is that please ask your dentist first before using them. Because we, as our dentists, we only use antibiotics, or we only prescribe antibiotics for those patients with very severe gum disease. Because antibiotics doesn't really work for mild gum disease. Okay, so that's why, in summary, for mouth rinse and antibiotics, please do not use them by yourself. Please ask your dentist first before using them. Well, sometimes brushing and interdental cleaning is not enough to remove all the plaque inside our mouth. And some of the plaque might harden, which will make it even harder to remove. And that is when you go to a dentist for periodontal treatment. Well, generally speaking, there are two categories of periodontal treatment: the non-surgical one and the surgical one. The periodontal treatment always starts with a non-surgical treatment, which is mostly scaling and root planing. What we would do is use a ultrasonic scaler like this and try to remove the plaque. Here are the plaque and the calculus deposit inside your mouth. Some of my patients ask me, will scaling session hurt my tooth? The answer is no, because the vibrating tip of the scaler can only remove calculus deposit but cannot harm your tooth structure. And actually, the effect or the therapeutic effect of scaling is actually very significant. As you can see, before the gum is very swollen with calculus deposit or plaque here, but then just after one scaling session, the gingiva will return to its healthy state, healthy shape, and healthy color. Sometimes if the scaling session is not enough, we would then, if you still have many heavy calculus deposit, or you have heavy plaque under your gum and the inflammation would not go off by just scaling session, then we would recommend our patient to do surgical treatment. Actually, there are many surgical treatment of periodontal disease, and please don't worry, because the surgery is usually done in outpatient clinic and is for sure under local anesthesia. So it's normally not painful and it's not scary. I will share some of the common periodontal surgery that we have. So first is flap surgery. Sometimes the scaling session would not help us to remove those plaque that is super deep down at the pocket. That is when we use flap surgery. We would lift the gum up and then remove the calculus deposit or the plaque under direct vision and suture it. Aside from flap surgery, we also have regenerative surgery, because as I said, in the periodontal disease, there is bone destruction, and the bone will not grow on its own. That is when we sometimes use regenerative surgery. That is when we put some of the material that will induce bone growth and causing bone regeneration. So we would lift the gum up, put some of the material inside, and suture it up, and hopefully those material will grow and form a better structure or better surfaces. Well, aside from that, there are also some cosmetic surgery. For example, we have soft tissue graft. Because as I said, gum recession is a very common symptom of periodontal disease. And if you have receded gum, your tooth will become sensitive. So some of the patients want those receded gum to be covered up again. That is when we use soft tissue graft. we would cut soft tissue from other part of your mucosa or other part of your mouth and transfer to this area to cover the recede gum, the recede gum. Other than that, we also have crown lengthening. So for some patients who have gummy smile, we would recommend them to have crown lengthening procedure so that the gum will look shorter and look nicer. I know you're a little bit confused again, so I made a concept map for you. So how to treat or prevent periodontal disease? They are actually not two ways. We need a combination of both daily self-performed plaque control and regular periodontal treatment. For daily self-performed plaque control, we have brushing and flossing. Make sure to brush 2 times a day with 2 minutes at a time, and make sure to floss once a day. For if the plaque cannot be brushed by just self-performed plaque control, then we should go to a dentist. And actually regular periodontal checkup is recommended. And for periodontal treatment, we usually have non-surgical treatment such as scaling and other surgical treatments. All right, before I end today's lecture, I wrote down some take-home message for you. So even if you do not understand or if you do not remember what I just said in the last 30 minutes, please do remember this slide. It's very important. So here are the periodontal health do's and don'ts. What should we do? We should brush our teeth 2 times twice a day with soft bristle toothbrush. Make sure that you use an interdental toothbrush or a floss every day. And of course, please see your dentist for a regular checkup, especially if you are planning to get pregnant or if you have diabetes. What should we not do? First, please do not smoke. Quit smoking. Smoking is very bad. Smoking is bad for your health. It's bad for your gum. Quit smoking. Other than that, please do not use mouth rings or antibiotics unless we prescribe to you. Third, do not procrastinate on seeing your lovely dentist, because preventing is always better than curing. Preventing is always cheaper. So make sure to go to your dentist regularly to have your teeth checked. So I hope you learned something today. I hope you would find the last 30 minutes fun or helpful. Just always remember that without gum, there will be no teeth. And without teeth, you will not have general health. Thank you again. If you have any questions, do we have any questions?
Yeah, we do have questions. So thank you, Dr. Ge, for your wonderful lecture. I think everybody watching this live stream have learned a lot, including me, because I still remember the first time I know how surprised and shocked I know for the first time that if I have severe periodontal disease, I may lose all my teeth when I get older.
Yes, that's very scary.
Yeah, that's very scary. So from that day on, I tried to brush my teeth twice a day, very carefully.
Good for you.
So thank you for giving us this information. So I think if you have any question, if you are watching this, if you have any question, please feel free to type in the chat box in the bottom. So I think we have 2 questions from the audience already. One question I think is about wisdom teeth.
Okay.
So I think this friend is asking if she had her teeth, her wisdom teeth extracted. Mm-hmm. So how to, like, what should she do to protect her gum, I think?
Okay, so actually, as a general rule, after tooth extraction, because there will be a hole, right? We call that a tooth socket. There will be a hole, but usually the gum will start to grow up and cover the hole. It will take a month, and it will take 3 months for bone to grow back. So it's very critical to keep your wound clean for at least the first month. You have to wait for the gum to grow back to cover the socket or cover the hole. During this time, what we would suggest you to do is after your tooth extraction, we would ask you to use mouth rings for 1 week. The reason for that is that firstly, because you just had your teeth extracted, the wound is very sore. It might be painful, so it might be difficult to brush that area. So mouth rings would help and used as an adjunct to kill some of the bacteria inside the wound. And after the first week, we will ask you to stop using mouth rings, because as I just mentioned before, there are many adverse effects of mouth rings. We would ask you to gargle after every meal to make sure that there are no food debris inside the socket or inside the hole, so that the wound will grow better and heal better. I hope I answered your question.
Yeah, thank you. And another question from the audience. I think he's asking, how often should we have our teeth scaled or planed?
That is actually a very, very good question. Well, as I mentioned before, there are actually two types of periodontal disease. In the milder form, we call that gingivitis. That is when we only have inflammation on the gum, but we do not have any destruction at the bone. At this stage, we call that gingivitis. We usually recommend patients with gingivitis to have their recall session at least 6 to 12 months, which is half year to 1 year once. So it would be nice if you would come to us once a year to have your teeth checked. And if we think that you should have a scaling session, then we would book an appointment for you and do the scaling. That is only for gingivitis patient, which is a milder form of gum disease. But if you have a more severe form of gum disease with bone destruction already, we call that periodontitis. For periodontitis patient, the recall session is more personalized. For those patients with more severe periodontitis or more severe form of gum disease, we might recommend them to recall every 1 to 3 months. But for those patients with less severe form of periodontitis, we usually ask them to come back every 3 to 6 months. And if their gum disease is controlled, then they could follow annual checkup. That will be enough. And plus, another thing is that if you have risk factors, such as if you are diabetic, then we might recommend you to come to us more often, so to make sure that your gum is perfectly healthy.
Okay, thank you. Okay, we have another question. So the audience is asking if he can wash his teeth only 1 time a day, just before sleep. So I think you have a lot to say to him.
No, that's not enough, because they actually did a study before, and they found out that if you only brush your teeth once a day, you cannot remove the plaque inside your mouth. The plaque will accumulate. So make sure to at least brush twice a day. Actually, I even ask my patient to brush 3 times a day. So I think 2 times is not too much to ask, right? So please make sure that you brush it twice a day. Morning, when you wake up, you brush your teeth. Before you go to bed, brush your teeth. And if you are a very, very good patient and you care about your gum health a lot, you can also brush your teeth after you eat your lunch.
Okay, so Dr. Ge, I have a question for you. So for the morning, do you think I should brush my teeth before meal or after meal?
Oh, actually, that is a very good question, and there is a debate around that. But I personally recommend you to brush your teeth before eating your breakfast, because when you wake up, you have a lot of bacteria inside your mouth that just accumulated in the past 12 hours while you are sleeping.
Yeah, so 7 hours maybe.
Yeah, 10 hours. 12 is too much. So I think it would be better if you brush your teeth first to remove those bacteria, and then, face your breakfast with perfectly shining teeth.
Yeah, that's what I do. Yeah, thank you.
Good for you.
Okay, if you have questions, please type in the chat box. If you don't have questions, then I think it means Dr. Ge's lecture have covered a lot, and she has answered all of your questions in advance. Then we will wrap it up for today.
Yep, thank you.
Thank you for watching this. We're trying to do more and more this kind of English patient education lectures. And if you have further questions, please scan with Alipay. Scan the QR code in the bottom of this page, on the bottom of your phone screen with Alipay, and you will find the mini program of our hospital. You can make appointments on it, or you can make online consultation with Dr. Ge. She is also registered on that mini program. So again, thank you for watching this, and hope you have a good night.
Yep. Hope you will have a wonderful Thursday. Just one more day to go.
Okay. Bye bye.
All right,
Thank you. Bye
Bye.
bye.